Ken has done a very nice job on the thighs and all that here. Well, one thing you want to take a look at before you even start is how far did your skin come down? Because you want your skin right down at the lateral malleolus on this side and the medial malleolus on this side, okay? Which isn't too far off in her case. So we'll just leave that as it is. So as we look in here, first thing before you even get onto the shin, you want to make sure both the medial and lateral aspect of the thigh have been clean, so we can see the borders of our muscles. You see that border right there? That tells us that everything from here down is set to go. Were you here for this demonstration? Okay, so if you want to hang out, you can. If you need to get going, you can too. You're all on bonus time, so that's fine. So of course, we want to save this blood vessel and nerve unit. They're not going to be on your second practicable, but they will be on your third, and they're easy to identify. So really, if you save these, I'm going to ask them, and they're going to be easy points for you. If you don't save them, I'm going to have to look for something harder. As I clean this up, you can see the border here now of this muscle. And of course, sometimes you may have to grab the little leg and pull it out a bit as you go. But you can see where this muscle is ending, and now you can take the tendon down from here. And so with just that little bit of work here, we can now see the gastrocnemius right there. And it'd be tempting to go forward blindly, but that would be a mistake. Because what's going on this other side here? In fact, your thigh muscle came to halfway down the shin here, but on the lateral aspect, it comes down 2/3 of the way down the shin. So you don't go blindly. You come along, lift up on the muscle, try to see where your border is, and work your way from there down. And as you do that, the muscles will start to separate out for you a little bit, but we don't want to separate muscles yet. And obviously here you've got to be very careful because there's really no margin of error at this point. So as I'm pulling on this a bit, we can begin to see this muscle back here, this big shiny tendon. That is the Achilles tendon. And here again we can see our gastrocnemius. There's our biceps femoris, and then later on we're going to come through and split things out. And we can also see here, we don't want to separate out yet, but we can clean the fascia around it. See this nice white tendon. And you already know what muscle that is, because you studied the groove on the lateral malleolus of the fibula. Anyone remember what the name of that muscle is? What was the name of that groove on the fibula that you were using to tell front from back? The peroneus, the peroneal groove. So this is your peroneus muscle right here. All right? So that's what you'll be doing. There's not a lot to it on this part, not till we get to the next step anyways. But eventually we'll separate all these little shin muscles out as well. And then later on today we'll do the back, the chest, and next week we'll finish all the superficial on Tuesday and hopefully begin going deep. Any questions? Okay.